Hey, it's Mark here from PressurePerfectMassage.com. I'm lucky to have with me Dr. Charlie Johnson here. He's a physical therapist in Limerick?
Yeah, Royersford. My practice is in Royersford.
Okay.
Yep.
So Charlie's going to be here and he's going to talk to us about lower back pain. But before we get into that, I just want to have you give a little bit of background about yourself.
Sure.
So if you do that, that'd be great.
Yeah, sure. So my name's Dr. Charlie Johnson. You can call me Charlie from here on out. Okay. Thanks, Mark, for the intro. Let's see where to start. So as Mark said, I'm a physical therapist. I also have a board specialty in orthopedics. And kind of my story is this. So growing up, most people go to physical therapy. They have like that great experience where that physical therapist helps them out. They fall in love with it and they want to give back, just like that PT did for them. For me, it was completely opposite. Grew up like a little bit of a broken family and kind of had to find my way. So the way it worked is I thought about being a personal trainer. I played ice hockey my whole life, so I was always in athletics and nutrition and things like that. And then I looked into athletic training, but the whole family thing said, no, I don't want to be traveling all the time. And then I applied to one PT school. I actually had never gone to physical therapy before, no experience with it, so I don't know. It turned out to be a good thing, but I made a good choice. And the way it worked is that I applied for physical therapy schools. I went to Lebanon Valley. That's where I got my doctorate. So Central PA, farm country, cornfields all around. And then I practiced for like a year and a half, like in the Royersford, Pottstown area. And while there was nothing wrong with it, I was like crazy about learning. I was always that annoying guy in the back of the classroom saying, hey, like, well, what about this? What about this? And everybody else had left, and I was hanging around trying to find the answers, right? So it was really hard to kind of do out there in just healthcare the way it is, very busy, things like that. So just with my drive to learn more, I decided to apply to a residency program. So for those of you who don't know, just like physicians can specialize. So if you have a heart problem, you see a cardiologist. If you have a foot problem, podiatrist. Kid has a problem, pediatrician, etc. Physical therapists can also specialize. So I went out to a residency program for a little over a year out at USC. Really great school out there. Did a lot of research on back pain, shoulder pain. Worked with a lot of different mentors. Also taught in the program. And now I kind of bring that back into my own practice, and I can treat people the best way I feel. Possible. So that's a little bit about me. So,
very cool.
Yep. Yeah. Thanks.
So what about lower back pain? So we have a lot of clients that come in and they experience lower back pain.
Sure.
Some persistent.
Yep.
That lasts 3 to 6 months, sometimes longer than that.
Yep.
And a lot of times there's this area where they're just not getting better.
Yep.
So what I wanted to ask you is how would someone at home who's in that position, or maybe you just started, what would they do from a PT standpoint? Sure.
Yeah, so let me start off. It's a general question, it's a good question, okay, but let me start off with like some big picture stuff. So if you're watching this video, you have back pain, you're on the right track already, okay? So a little secret I'll let you in on, the single biggest mistake people with back pain make is they ignore it, all right? So there's a few ways to handle any problem in life. You could ignore it and just kind of, a lot of people with back pain, hey, I'm getting older, or hey, my mom had it. It's bad weather outside, although there's some evidence to that. And then you can kind of the next step would be medications, something like that, and then the final step will be get to the root cause of it. So the fact that you're trying to treat it or looking for solutions is already not completely ignoring it, all right, which is great. The biggest recommendation I can say for people with back pain is that your life starts out think 10 years ago, okay, maybe before you had back pain or when it all started, whatever, okay? Think back to a time when you could do a lot of different things, right? So you start out and your life's a big cube. You've got all these high-level activities. You're playing baseball, you're running around with your kids, you're doing whatever you want to do, okay, running outside, whatever it may have been for you. You were able to do all these high-level functional things. And then maybe back pain came into your life, in this case, and you said, oh, I don't know about that. I'm not so sure I can go running or do this or do that. And, maybe, you didn't do a whole lot about it at the time and you thought it would just go away. Again, if you're watching this video, maybe it hasn't. And then you said, okay, I'm not going to do all those things. I'm just going to do these things. So you kind of scratch that part of your life out, and then it kind of boils down to you having maybe trouble if you're just sitting, or if you're just driving in the car, you know, some very basic stuff. So the biggest recommendation is to kind of fight that battle by staying as active as possible. So back pain can easily control your life, and there's a way out of the trap, and I can talk about that in a minute, but really try not to let it limit you. It doesn't mean you have to push through significant pain. It just means challenge it a little bit, okay?
It's sort of a gray area, right?
It's a gray area, yeah. Yeah, it's a gray area. So let me start on kind of how to maybe get out of that if you're at home watching this, okay? So, yeah, so you want to stay as active as possible, all right? And then the other thing is what I find interesting is that people have had back pain for so long. When I ask them what, so one of the important questions to think about and ask yourself at home if you're trying to get out of this cycle is you want to ask yourself, is my pain, maybe numbness, tingling, whatever it is, okay, reproducible? All right? And what I mean by that is what are the specific things that make your back pain or whatever it may be feel worse? All right? So again, what's interesting is some people have had back pain for so long, and when I ask them that question, they just say everything. Everything hurts, right? So, and while everything may seem to hurt, often what we can do is, if we really think about it, right, we can come up with specific things that, you know, actually don't bother people as much as they thought, and specific things about, say, sitting. Maybe it's sitting on a couch or that favorite chair, or maybe it's sitting only in the car, or maybe whatever. There's certain ways to kind of narrow that down, and the best way to do that on a day-to-day basis would be to journal. All right, so you want to journal, maybe take a piece of paper, block it down the center, and write, you know, maybe better and worse, okay, 2 columns. Right. And on one side, you just want to write down all the specific things that make your pain, numbness, or tingling feel worse, all right? And on the other side, you want to figure out all the things that make you feel better, right? Because that's kind of cool then, because even though, you know, you may have not, you're not out in the clear yet, you're starting to build some awareness about what those things are, right? So then the ultimate goal is, and it sounds simple, okay? It's not this simple, but the goal is that you want to do more of what makes you feel better and less of what makes you feel worse, right? If you've got 50 things on the left-hand column, cool, because you've identified all those things, and maybe there's just some little tweaks you can do there, all right? But, you know, and then you've got 3 things in the better column. It's going to be really hard to heal like that, okay? But the first step is you got to journal it, because you have to be aware of what those things are. And I would say probably the thing moving forward with that is, yeah, if you know what things make you feel worse and you know what things make you feel better, let me see where I was going with that. Can't remember.
Well, while you're thinking about that, I have a caveat.
Sure.
Right. So I did, like, I don't know, 15, 20 years ago, I injured my back, and I went hypervigilant on it, right?
Yeah.
So I started, I journaled. I'd have a tape recorder next to me.
It's great. Good stuff, man.
Analog. Right?
I know where I was going.
So I'd be I'd be like talking about, like, you know, this back pain is going down to my, you know, my leg. It's blah blah blah.
Yes.
I got to the point where it was just like I was so focused on the pain.
Yes.
That I think I just was making it worse.
Good. Perfect.
And the other thing was, like, I just at some point I stopped doing everything. Not that you should stop journaling. I think that's a really important thing.
Yeah.
But I wasn't being realistic about it. What was really bothering me was working out.
Yeah.
Do you know what I mean? Everything I was doing working out was actually probably precipitating all of that.
Yeah.
It wasn't the massage, it was anything like that. So once I stopped doing that, I had a clear slate, and I could go from there. But
okay,
I'm just saying, the warning was that for someone like me who becomes hypervigilant, it's like, you know, journaling with a caveat. Yeah.
Right. Okay, so that's great. So, journaling with an exception in that, yes, once you identify those things, think of this, like, pain is your alarm system. So for everyone watching, where is pain created? So pain is an experience created by the brain, all right? It's not made up. Better way to put it is that it's an output from the brain, all right? So you have kind of like, you know, sensory input coming in from your back, whatever you're doing to bother it, okay? And it's going to the brain, and the brain is saying, wow, like, is this a problem or is it not, all right? And being that pain is like your alarm system, you could think of it like that. Sometimes focusing on it and cutting all those things out of your life and paying attention to it 24/7 can actually make you feel worse. Other things that make a lot of people feel worse are big and ugly things found on x-rays and MRIs. It should probably be one of the last resorts, all right, in that we know that people who know the results of their X-ray MRI actually end up doing worse, okay? So what we find, and the reason I say that, you know, it freaks people out, the reason I say that is because there is very little correlation between what we see or what we find on imaging and what people actually feel. So with that being said, I mean, we know that 80% of people over the age of 50 have spinal stenosis, DDD or degenerative disc disease, arthritis, and they feel zero pain. 60% of people over the age of 50 have a herniated disc and feel no pain. And the reason is if you think about it, right, so if you think of pain as your alarm system, right? At any given point, we have 400 nerves in the body, 45 miles of nerves, all right? It's a lot of nerves,
That's a lot of nerves.
right? So the alarm system's just primed and ready to go.
Right.
If you give yourself a paper cut, all right, what's going to happen? It's going to say, ow, right? It's going to hurt, but how long is it going to hurt for?
Well, until not long, hopefully.
Not long, hopefully, right? Right. So, so then think about this, right? So maybe a paper cut, maybe it's 4 or 5 days.
Right.
Back pain, we have good proof of this via some specialized imaging. Herniated disc, for example, will heal within 3 to 6 months. You will actually get some reabsorption, and the body will heal itself. The body's an amazing thing.
I think that's a very interesting point because I don't think people, at least I didn't realize that it heals.
Yeah.
I thought done. You know what I mean? So there's that healing process that happens in 3 to 6 months.
Yes, and a lot of times people, you know, they look at that and yes, they kind of close themselves in and say, oh my gosh, I've got this big ugly thing going on. How am I going to get past this? And rather than seeing it as sort of a loss, understand there's a possibility there because with this information I'm telling you, you know that things are going to heal, okay? The question then becomes is why does this pain persist? All right, and the pain persists if you think about it. Would you be freaked out if your paper cut, you know, hurt for 6 months?
Yeah, that'd be pretty freaky.
Pretty freaky, right? Because you can see it and, you know, you might be questioning it. Well, you know, what makes the back any different, right? So if it's persisted past, say, 6 months, you know, then the tissue should technically be healed, right? So what continues to cause this pain, all right? And it's a couple things. It could be as simple as there is an issue within, like, you know, the back or the tissue or something like that where you continue to aggravate it, sitting poorly, lifting poorly, doing whatever, okay? It doesn't just have to be poorly. It could just be that your job requires that you do something repetitively that irritates it, all right? But the other thing is that there are other factors to the equation. So you've got, yes, tissue could be an issue. And then the other thing could be, yeah, good rhyme there. The other thing could be that how do you feel when you have back pain, right? Good or bad? Probably not too well, right? So when you're not feeling well, how are you sleeping? Probably not too well. When you're not sleeping well, how well do you perform at work? Probably not too well, right? And then you start to see this cycle, you know, and then you go to the doctor and the physician tells you you have a herniated disc or something going on in your back, and that makes you feel even worse, right? So there's a lot of low points that continue to kind of heighten your awareness to your back pain and sort of freak people out. So, you know, I'm here to tell people that there's hope, okay? And there's definitely a way to live with less lower back pain and get back to normal, and that is through conservative measures. You know, physical therapy is a great alternative, and a lot of times now it's seen as something sort of on the back end where people, you know, they go see their physician, all right, and the physician usually will prescribe some type of medication and or rest, all right, and then perhaps an image up front, and then, you know, maybe down the line physical therapy. At which point, that whole time when people were having those aches or pains could have been handled up front by just seeing a physical therapist who is also trained to identify big ugly things, okay, that should be handled elsewhere.
Right.
So you can save a lot of time and a lot of money and then really get to the root cause of the problem and learn about what's going on, right? So this education is really important. So
if someone comes in, someone like they do the home technique here,
Sure.
so you start to journal, you start to pay attention to things, right? Then you start to read, you look at your columns, and you start to maybe find an association, look and see, okay, well this happens, this pain happens when I'm sitting like this, or when I'm at work like that. So you reduce that, but you also, at this point, you stay as active as possible. You're not trying to knock things out that are not bothering you.
You're listening to your body.
Listening to your body,
right? But you're kind of challenging it and staying as active as you can.
Right.
Okay. Yep.
And so as you start to make some wins, you start to, maybe the column sort of shift. Now so that becomes like, you know, it doesn't hurt me when I sit like this anymore. Or it's healed enough, I'm not irritating something that I can sit like this, right?
Yeah.
So you start to get more wins on the other side. What happens to the person who doesn't get those wins? It's persistent, they've done that, like if they it would be time to come see a PT. Like the way
Sure.
you're saying, it's the other way is sort of like you go through the system, you get your shots, you get your X-ray, you get your MRI.
Yep.
But like to me, it's almost formed. Like I'd go to the PT first. Like
Yeah.
it seems like let's bring out the big guns.
Yeah.
Like how would that look to you? Like if someone came to see you in that condition, they had persistent chronic back pain. They tried, they were attentive, and that
Yeah.
wasn't working.
Right. So, so we see people a lot of times with chronic back pain, and we help them out a lot as physical therapists. Sort of the simple answer to that is if you've been doing something over and over again and it hasn't been working, and people are expecting the same result, that usually doesn't work, right? There's a word that describes that, right? And it's kind of being kind of crazy in that sense, right? Like doing the same thing, and it just continues to get you the same result, which in this case is not being able to live your life and being in pain or on medications or whatever, okay? So the way to think about it is there's two ways to approach this, all right? Actually, probably three ways. When you go to see a physical therapist, the way that sort of our profession has laid it out is that we're movement experts, meaning we really understand how the body works together and how it moves and how everything, including kind of, some of your worries and your fears about what's going on, some of the things you've been told in the past about what's going on with your back via imaging or other practitioners. We really kind of look at you as this holistic kind of package, right? Because everyone's unique, right? So when they come to physical therapists, it's really the most important thing we can do is listen, right? And if you listen well enough, you shall find the answer often. And that, we listen to, say, your story, about your back pain. We try to lay out, hey, what makes it feel better? What makes it feel worse, right? And then, so we're listening, and then we're identifying our own little list, the PT's own little journal, right? And then maybe it was just that you didn't have the education to figure out how to make those things that were making you feel worse, how to eliminate those things, and that's where we come in, right? We also come in from a progressive, educational standpoint as far as how to get back into the things that you love to do without setting off your alarm system and kind of going back to square one. So that's education. The other thing is that we go, we look at it from a treatment standpoint, and the treatment standpoint is, yes, two-toned in that it's modifying maybe some activities early on, okay? But then it's really looking at the root cause. So, sure, there might be a disc herniation, all right? And it may or may not be the problem. It doesn't matter a whole lot to me. That's not to say I'm going to ignore that thought, all right? But I'm not going to let it completely guide me, all right? In that, what we'll see is that treatment, that might be the source, the problem on the x-ray or something like that. You might point to a certain part and say, oh, it's right there, it hurts there. But the issue might be from somewhere else, all right? In the case of, walking or things like that, it could just be that you have a little tightness, say, in the hips or in the mid-back. Or it may be just the way that you're doing certain things.
And you would prescribe exercise for that or stretching?
Perfect. Yeah, so we would bring you through basically an exam, a variety of movements. And what's so cool about what we do is that we try to teach you ways right there and then that can take away your pain immediately. Meaning, if you have trouble touching your toes and you do it your preferred way, all right, and then I show you a different strategy, and all of a sudden you say, wow, that feels a lot better. Not only have you gained control over what's going on as the patient, okay, or as the person with back pain, because you now know, what was that about? I've been doing this for 10 years like this, and it hurt, and now all I had to do was that, right? So you have sort of this aha moment, and you gain some control, which is great, so you have power. But then also it guides our treatment, right? Because then we know what specific things are aggravating it, and then we can sort of put the pieces together. We put the pieces together. I've gone to school for a long time, so it's a little complicated, but we look at how the different muscles and movements in the body sort of interact. To bend over, you need certain strength in certain areas, you need certain flexibility in other areas, and you need certain control overall. And we would basically come up with a program to teach you those things and sort of tailor it to the person with back pain, as well as combining that with educational kind of aspect that we talked about earlier.
So it's applicable to life. It's not this static thing like I'm going to be doing 10 leg extensions. It's like movement and how you live. And
yeah, the goal is that, right, that's where the listening comes in, right? If somebody comes in and tells me I want to get back to running, I'm going to, maybe in the initial phase, do some basic things to get the pain under control. There's a few phases, right?
Right.
But then, and do some hands-on stuff to sort of reset the system and decrease pain, all right?
Right.
But that's a very passive approach.
Right.
Passive approach, and that somebody is doing that to you, all right? And at the end of the day, you have to be able to control your own back pain. So we want to teach you things that look, that sort of move you closer to that task that you want to get back to, that part of life that you want to get back to.
Right.
In that you understand why you're doing it, right? And that it makes sense to what your goal is. I mean,
Gotcha.
that's the goal right there.
And if that doesn't work, you give him a cortisone shot, right?
Oh yeah. Yeah. I gotta send them across seas for that or something.
Okay, you just don't have
send them out. Yeah,
like
yeah.
slip one in and
Yeah.
okay, no, it's done.
Yeah, don't do that.
Yeah, okay.
Yeah, sorry.
All right.
I advocate against that. You only get
Yeah.
3 a year anyway, so.
Right. It's about integrity of joint tissue kind of thing. Yeah.
Yeah. The injections with the steroids or whatnot. There, sometimes people with like blood sugar problems, it'll rapidly increase your blood sugar because it's a steroid, it just messes with the tissue for a
Okay.
while. So,
Yeah.
Yeah.
Hey, well, thanks. So what we're going to do is, like, on our website, we'll have Charlie's information. If you
Yep.
want to get in contact with him, if you have any questions, can they just, like, email you, like, with questions and stuff? Yeah.
Sure, yeah.
Yeah.
We'll include the email up there,
Okay.
as well as my business line, and I'm pretty open with people. So if anybody has any pain problems, questions about anything, I'm really open in answering
Okay.
anything. So it's what I do, it's what I love. So
Yeah.
I'm here to help people out. Yeah.
Yeah, and I can second that. He's seen a couple of our clients, and he's been really, really, really good with them.
Thanks,
And
appreciate it.
free with the information and just sharing and everything. So,
Yep, that's the goal. Yep.
all right. Well,
Cool.
thank you, and thanks for watching.
Yep.
And we'll see you again on PressurePerfectMassage.com.
Thanks, everyone.